together today at 1:05, and I'm going to ask Councilman Thornton to give the invitation.
Dear Heavenly Father, we thank you for this beautiful day. Bless this wonderful food that we can take and have. Bless the employees here that prepared it. It's sure delicious. Thank you for that. Thank you for letting us gather here today. Be with each and every council person, each and every administrator. Help us come together and do what's good for our people. Jesus Christ, we pray.
Before we get started here,
Do you have your is that a gun? I think she's going to send that guy over here.
Carla is going to address us here for just a second.
I'm not going to do anything here because I'm not going to stay.
Oh, yeah, just go ahead. I'll let her know you're on your way.
Okay.
I just also wanted to draw your attention to the Photo Boys project, which is the posters around the room. We participated in this in last part of 2009 and into this summer. It was completed in June, and these are on your in front of you to tell you about the project. Basically, it tells about the uniqueness of our program. What does it mean to be Cherokee and a child enrolled in our program? So if you get a chance to walk around and look at the posters and read them, we invite you to do so. And also we have kind of a thank you gift to y'all. They'll pass those out. But we enjoy your annual visit up here and have your meetings here all day. We'll be back in a minute again. I look forward to it. We certainly enjoy food, especially that roast. If you'll raise your hand as a council member, we'll, okay. Thank you so much, Marty. This show has been called Roll Call, please. Council Brett. Here. Bill English.
Here.
Jack Baker.
Here.
Juliet Hess. Evan Hitchcock. Here. Mary Bradley. John Garvin. Connie Gloria Jordan. Present. Chuck Hoskins Jr.
Here.
Lee Keener. Dick Light.
Here.
Curtis Snell.
Here.
David Thornton.
Present.
David Watkins.
Here.
Eric Allen Watson. We need to approve the minutes in the previous meeting. Second. All in favor? Aye. Minutes and approved. Councilmember Laura Jordan.
Yes, I'd like to make a motion to amend the agenda. We have two items that are in front of you, a resolution authorizing reimbursement for non-funded and underfunded home care services. And then we have one, a resolution authorizing the funding of Cherokee Nation Home Health Services. And I would like to make a motion to amend the agenda for these two items to be discussion only.
Second.
Thank you. All in favor of that? Aye. All opposed? Okay. These two items have been added for discussion only.
Did, I'm assuming my report's in your packet? My apologies for being late. I've never been to this campus before. So, I blame it all on you. The report that's in there is for the year end, fiscal year end. You can see we collected, 12.8 million, which was up from the year before. We knew that the new medical director, Dr. Charles Matchie, started work on the 7th. I planned on bringing him down here, but he's jumped in with both feet, and I couldn't get him away from the docks today, so I'll get him down here next month. Any questions on what?
George, I have a couple of constituents called. I don't know whether this is an issue with IHS or the cities, but like, for instance, Sky 2 ambulance will only deliver for Cherokee patients to Bailey or St. John's and Owasso. They won't take them all the way to Claremore. Do you know what may be causing that to happen?
Now, a lot of that depends on what they're picked up for. If they're picked up call to the house, picked up on sick call, it's my understanding that they were allowed to transport wherever the patient wants to go, unless it's a life-threatening situation. And if that's the case, then by law they have to go to the nearest emergency room. So if they pick you up and you're out here in a crash or something, a car crash, or it's a definite emergency, then they're required to take you to the nearest emergency room. But as far as I know, if you're called on a sick call, somebody's at home sick and they call the ambulance, they're allowed to transport you wherever you request, you're paying for it.
So that could be a city policy then that
Yes.
dealing with, need to check with the city and see if it's.
I would check with that ambulance carrier.
On that, a lot of times it's like George said, if it's an emergency bylaw, like each EMS unit has a medical director that has protocols in place. The problem then you get into is if it's deemed non-emergent, and often you won't get Medicare and Medicaid private insurance paying for it, and so they want to keep it deemed as an emergency, and then by law, and so that's where it all comes down to whether the protocol is already that particular ambulance is active. So whoever their medical director is, that's the protocol.
This particular call I got this morning, he said he was being sued for the remaining, for the ambulance transport. But he didn't go to the hospital of his choice.
Yes.
Of the 5,000 miles, are those category 2, 3, 4? Walk over?
Actually, some of those are going to be category 1 non-life coverage.
What percentage would you project for category 1?
Those are probably 10 or 15%, just a rough.
And from last year, to know what the number was on mile dates? From last year's number, last September, October?
I don't know what last year's FY 10. I don't know what that. I can get it for you.
Okay, that'd be good. And you notice if there's a trend, up or down?
Okay.
Thank you, Madam Chair. George, I know that, I think, let's see, here first. Anyway, I think on, there was, last month, the board committee, you indicated it would be very difficult and time consuming to go back to the records possibly, but now maybe I'm hearing differently, to gather the information, because we needed to know if it was Cherokee Nation citizens specifically, not Eastern Band or United Katua Band, and we needed to know what kind of category was being on.
I can go through and pull, well, I tried. That's, Denny's told me that's an easy report to run. I'll have to find out how easy, how difficult it will be to go back and do it by tribe and by categories. But I'll be glad to ask.
And so, Madam Chair, may I continue? So specifically, I would like to understand the number of Cherokee Nation citizens being denied this coming month and going forward, if we have even recent data or even past data, that what category they would fit, and we'll need a key because that's going to be different than our categories of contract health service or Cherokee Nation. So all lines are clear, especially for the new council people, and a financial quantification of what the denial is also.
Okay, the dollar amounts that we got are actually fairly close estimates on what the contract health staff put down, and that's what people run off of.
No, that's great. That's better than what we have now, which is nothing. Thank you, George. George, would it be possible for you to write that down by county too? Where the miles were by county and in Wagner County, if you would break it down to what's inside, jurisdictional boundaries and what's outside. So let me make this clearing on in this room still. So just to clarify, you wanted to know the reason, like if it was denied because they were out of jurisdiction or not? Was that very good? Okay, thank you. Council Bishop. Thank you.
She wanted the same information, so.
Oh, okay. Anyone else have any questions or anything for, thank you for that good report. On to the Cherokee Nation Health Services, Dr. Gloria Graham. Good afternoon. Hopefully everybody got our report, for this month. Some of the, big things we're working on is the drive-by cases, we're still doing quite a bit of construction there, and the Mason project, so we're excited. I know you were at the show last week or last, helping off ceremony. That's gonna be a pretty amazing facility too, so we're excited about that. Other good things, our billing has been up. We get provide more services, our billing continues to increase. And otherwise, I'm open to any questions that you may have, or. Yes, Councilman.
I was looking at third party recognition, Jay. Did you, send me an email on something on Wax or below? I'm kind of curious.
Okay.
It calls lot, 1, 2, 3, 4, about 5th on there, but I know there's still a lot of paper. And then I had sent an email requesting admin, the, group leader before you had, I just want to know whether you did it on the investigation or looking into the, social couple contract. I think from young adults, they had how much other ones to another. It was done, I think, in August perhaps. I'll send you an email if you do that.
Yeah,
Well, I sent it to, two or three of them over there. But I'll put it on and send you one. I think Cherokee looking into it.
okay, yeah, I can just send it.
Okay, I'll do, the contract was quite a bit of money.
Okay.
Yeah.
And on your answer about J revenue, there's a lot of things that I'll look at. Sometimes it depends on how much, what percentage of the patients there have third party and it varies by clinic. The other thing though is now that we have a pediatrician, we're trying to build up some of that Medicaid revenue. So, but I'll write you up a little detailed response.
Okay, the other thing is, what are we doing about getting more doctors, dentists, primary care people in our clinics and hospitals? That is the biggest drive I've had for the last 4 years. And I look at our budget, and every year we carry over millions, and a lot of those are salaries.
I agree, and I asked the question actually last week. I don't know what Deborah thinks about this or not, is if there's a way that, one, look at our revenue every quarter and adjust it accordingly instead of waiting until the end of the year and having this giant amount of carry over. And two, it's time again to really start looking at our staffing. And so we need to look at that, and Dr. Silver, so I'm sure he would attest to the fact that we definitely want to get some more positions. And some of the places, a space issue, is not enough space for everybody. That's not true of all of us.
And that's my next one. How far is Sam Piner?
Down
Yep.
on the list. I will have to look into that. That was something that the first leader before me was working on, and I know they were trying to buy up some space and build a new facility. And I honestly haven't looked at that to see where they were. I know they were looking at buying some houses and some land there to potentially build a new facility. So I don't know where that is at.
And our chair is going to argue with me, but Wilma Peak needs more space. We have got people hanging everywhere.
Yeah, no, I agree. There's lots of things.
I realize, I'm happy for everything we do and all the services we provide, but that place is overlooked. So could you kind of,
Yeah, they're gonna do that.
and then you might check in with the credit.
Okay.
Thank you.
You're welcome. Counselor,
Do I understand correctly that there's going to be a career fair for the beginning clinic in the near future?
yes.
And that's something career services is like primarily not you guys.
We're not, no, we're just, but we'll have representatives.
Thank you.
Counselor Watkins.
Dr. Grimm, this Councilman Walker Stick. Our emergency room at Hastings, it gets overcrowded quite frequently. And I know we're talking about the staffing. Is there some way that we could get maybe an extra PA in there, or maybe an extra doctor during the high volumes of time?
We've actually, we're expanding, I don't know if you've seen.
Yeah, the emergency room.
Yeah, so we're gonna be expanding that, and with that, we're gonna be able to divide it more into true emergency care versus urgent care, which will still kind of come in the same area and get sent whichever way you really need to go. And with that, we're gonna look at, again, increasing our staff. And right now, we have, 1 12-hour shift a day where we have extra coverage. Our AO there is looking at, he's done some analysis looking at the most busiest times and when we need extra people. And it picks up really about 4 o'clock in the afternoon when all the other facilities are starting to wind down. And then there's a big, from about 4 to, 8, there's a huge trying to catch up. And so we're looking at that and trying to figure out.
I heard a story a while back from my buddy in the emergency room at first hit. And I guess there was a person next to him that was having a heart attack. And they was unable to get to the person. And so I was just, that brought a lot of concern to myself.
Yeah, and if you could get a name, because I find that really difficult to
Well,
believe.
that's what he called me.
Because they immediately, if somebody were having an
understanding, I'm 2 doctors short
You
up
are.
on the north end, and as I understand it now, they went to Muskogee and another one of our facilities, is that correct?
Yeah, one of
Are
them,
you guys paying more down south than I can pay them up north? Where's my doctor? That's what I'm asking.
unfortunately, Muskogee, everybody wants to go there, because, I don't know, it's, a lot of people live in Tulsa and go drive back and forth. We do have one doc hired for you, but they're not gonna start until summer, which is 6 months away.
Let me, if I may, if you're going to do that, I understand maybe they want to go somewhere else. But you're leaving us without doctors and you're filling
Right.
other places first before you start recruiting our doctors. That, we don't like that.
I know, and docs kind of have it, because if they say either, I know you got a vacancy, move me, or I'm leaving your whole system, then that creates a, yeah, kind of, and not all doctors are like that. A lot of doctors are, I'll stay until you find somebody because I don't want to be short-handed. But then there are some others that say either move me or I'm leaving, so,
We need 2 doctors.
I know.
And-
We're working on it.
And this recruitment thing that we got going apparently isn't working when you don't have them in place. And I'm just asking where they're at.
Yeah, and it's not that easy to recruit positions.
Well, I understand.
And so,
They're not on every street corner.
but so we're working on it, and right now they've got somebody for summer, but we still need somebody else.
I appreciate you keeping working on it.
Work hard on it.
Thank you.
Thank you. It was brought up last month at committee by another council person about possibly looking at Cremore Indian Hospital and compacting the entire facility. Is that on the agenda for the administration? And maybe you may not know, so if we can have an answer next month, I would appreciate it.
Okay, as far as I know, that is not on the agenda, but I don't want to speak on behalf of the administration without first asking that question, so I can answer the question.
And also specifically about contract health service and compacting those dollars from Cremore Indian Hospital. I know that we have the financial numbers, and that needs to be evaluated, and we need a decision on that because that's impacting 11 of our 14 counties.
And to be fair to the new administration, it's only been a month or so, and, we just haven't had time to sit down and fully brief the new administration fully on everything that's going on in all this shit, so.
Thank you.
Councilor Thornton?
Yes. Have a complaint. At Redbird, you moved the doctor to stuff. Now we have transfer stuff. Very good. I said, the doctor, you do need, I think everybody needs physicians. Those kind of things. And new clinical, the numbers are going up a lot. I can understand why, yeah, because I have a doctor. But I understand why. I know that my doctor lived there for Gibson.
Yeah.
And it was closer. I don't blame her for that. Hastings Hospital, I've had 2 dealings with them in the last 6 months. First dealing was my great-granddaughter's daughter. My granddaughter couldn't have been treated any better, and the family couldn't have been treated any better. And the people that were in there already, came in there, they were all treated the same. And they did a wonderful job. The second one was August, was in July, 2011. I walked in there myself, and I was having a heart attack. And they didn't want me from there. I walked up and told them, I think I'm having a heart attack. And it wasn't less than a minute, they had me in the back room. And was pulling my blood. And got me sent up to OSU Medical. So, I'm really grateful for them. They've really done a good job for me, for his family. And Then I've got a couple of constituents that live around our home. And they made the comment here lately, just in the last month, they've been in the hospital in Hastings. And they really appreciate the way they've been treated. And that the personnel working with them have done a great job, they're always smiling, they seem like they're happy. And, you know, I know we get complaints that certain people don't fall in to the limelight and fall through the cracks. So I think they're doing a good job. Of course, we could always use more of
I know.
it. Thank you.
Thank you. Any other questions for Dr. Green?
I just wanted to make sure you be able to stay for our discussion on home health.
Yes. Thank you. I'm remiss here because I didn't introduce Dr. Skylar Stillberg, and he was my physician about 10 or 12 years ago. An excellent one, I might add, down at Redford. He's very good at diagnosing things. I went in there and he said, "Lady, you need 2 new knees." I said, "What?" "You're going to need them." Well, he's like a fortune teller, so I got my new knees last year, but I'm very glad that he's on our team. I know, I made it quite a while, he said, but it's eventually going to happen, so I'm happy he's here with us today. In old business, ending, and our new business is our resolution for discussion on here. And I and Mayor Fraley, the Speaker of the Council, are the sponsors. And one of these is a resolution authorizing the funding of Cherokee Nation Home Health Services Life Care Program for the amount of $250,000. And everybody's got a copy of this. It's pretty self-explanatory. And the other one is a resolution authorizing reimbursement for non-funded and underfunded home health care services provided to Cherokee citizens by Cherokee Nation Home Health Services. And Mr. Rick Richards is here, and he can explain what problems they're having over here with underfunding when people don't have a source, a payer source. That can be a real problem. One day, I don't know, about a month ago, I was over at the cancer doctor, and the case manager came out there and told me that she had contacted Cherokee Nation Hospice, which was this group. It was a big miscommunication, but they thought that she didn't have a payer source, but it really came out she did have a payer source. But I understand where they have to take people who don't have any funding, so it can be quite a problem because there are people who don't have Medicare, Medicaid, or anything, and someone has to take them. So I don't know, since this is for discussion only, and my daughter used to work for home health, and she said everybody was required to share equally the people who have no way to pay, and I think maybe we're getting them all dumped over on us. So Councilor Morton had something to say first, I think.
Yes, I'm going to understand. So I'm just going to add it as a sponsor.
Okay. Sure will add you. Okay, we're going to open this up for discussion. Councilor Montgomery.
Rick, I went over both of your resolutions today, and I remember that you had come to us, was it last year, and asked for the line of credit for just under $800,000, wasn't it?
Over 400,000, right?
So you draw 400,000 down on it, or
We're at 305.
305? This is a really competitive business, isn't it?
There's 40 agencies serving Cherokee County.
And this business was set up for profit, is that right?
We're chartered as not-for-profit.
But we're not breaking even, are we?
Well, we're just not quite there.
Well, actually, in the last 3 years, last 4 years, we've lost $277,000.
That gives us a summary real quick before we get started.
Yes, we like to.
So About 12 years ago, the tribe moved the home health outside the tribal system because reimbursement had dropped so low that we could no longer afford to operate inside the tribal system. At that time, we received $400,000 to move out and set up as a not-for-profit independent corporation. In that 12-year time, we produced $42 million in services with about $27 million in payroll. We've served an estimated roughly 8,000 to 10,000 patients in that time period, most of who are Cherokee. Today, our impact is about 75% of our employees are Cherokee or Cherokee impact. As Councilor Jordan pointed out, the last 3 years have been very difficult. Once gas hit $4 a gallon, and we saw the state revenues start to fall, and we saw insurance companies begin to cut back on benefits. We see a lot of people with some coverage, but it's very, very minimal. So what happens is we get reimbursed $60 for a $125 service. So we've taken on Cherokee citizens who have that type of insurance just because we don't know what to take. It's very true what the chairperson has said, that we've always had a practice of taking Medicaid and also some insurance patients who insurance don't reimburse very high and non-funded. And we begin to see that push this year of agencies channeling those lower funded patients to us who are Cherokee. So we continue taking them through this physical year just because we always had that historical practice. And as of September 30th of this year, we basically cut it off. In other words, we quit taking any non-funded or anybody who doesn't have an adequate payer source. So if it doesn't cover our costs, we have to quit taking it. So as of September 30th, we quit doing that. Unfortunately, what we're seeing is a lot of health insurance companies aren't covering costs either. So some of those companies include Blue Cross Blue Shield, Community Care, and a few of those others. So we're no longer taking those patients. So as you see, over a 12 or 13-year period, we've had a $42 million reimbursement or revenue. We've got about $250,000 shortfall. Most of that's happened in the last 3 years. The economy began to tumble on us. So I hope that kind of sets the stage for you. Today, we're at 750 patients over 10 counties, including Cherokee Elder Care, which is the patient program. And we have about 300 patients. So we're, between both programs, averaging about $1 million a month in revenue. So I hope that kind of sets where we're at. Thank you.
The reason that I asked for this to be placed on the agenda for discussion only is it appears that we may be putting a Band-Aid on a bigger problem. And I wonder if we shouldn't take a month to maybe have Rick get with Dr. Gloria to see what aspects of the business could possibly be moved over to our health area and funded with our federal health dollars. And maybe then that would take some of the pressure off of home health care, and maybe we can get them back into the black. But I think that's going to take some communications between the two areas so that maybe we can turn this situation around and get you out of this hole that we've got in.
Well, I think you're right, because we find ourselves kind of doing, for lack of a better term, almost a public health nursing service. And because of who we are, that's very much expected of us.
And so that was why I asked Dr. Gloria to stay. I hope that we can put her and Mr. Richards together, and then they can come back with a unified plan in a month that maybe will help both areas and will allow us to use health dollars and maybe not have to use our carry forward money that will be available in March, because right now that's all we have to fund these requests. And I'm hoping that you all put your two heads together and that maybe by next month can come back with a plan of how we can turn this thing around. And with that, I I wanted everyone to have the ability to ask more questions, and then I was going to make a motion to table, and I'm gonna wait until everybody gets their discussion done.
We've got 3 or 4 items here on questions. Councilman Watkins, tickets next.
I have that 750 of your clients. How many of those are Cherokee?
It'll fluctuate between 60 to 75%, depending on the census.
And then I assume the rest of them are Native American or
Because we're Medicare only, or Medicaid, we don't discriminate, so the rest will be some native, other tribes, and also community members. Okay.
that's it.
Okay. Councilman Cherokee Watts.
Thank you. And I apologize, my laptop crashed and I still haven't got to your emails, so I was trying to figure out, the long-term implications, because I think I'm concerned as well that we won't be able to sustain assistance. And I'm confused why we have 2 different pieces of legislation. I thought we were only considering 250,000, but it looks like we're considering 500,000.
So we're looking, we want to look at them separate. One is the future for the non-funded group. Typically, we're getting referrals from terminal individuals from our clinics and hospitals who have no funding at all. And so we find ourselves supplying that group with pain medicines and nursing services. So we want to have that opportunity to get.
Because I also understand that we're somehow using this money to replace contract health services when they're not covered by our existing system, and that is very problematic to me. So that was, another council person made that statement to me prior to this meeting. So before there can be any vote, it's not that I don't support and I don't want to help, but we don't even have our current cash reserves in place right now for the tribe, should anything happen with federal funding to pay a payroll period. So if we're going to obligate into this area, then I need to understand, like, is that a one-time thing and we're going to remedy where we're at and there's a long-term solution to keep out from having to fund this continually? Are there places where if there is contract help being covered in this, that's problematic to me, those kind of things. So we need to make sure that there's,
I think I have an idea.
okay.
Typically, the federal government has a law on books that says something about Medicare beneficiaries are supposed to be able to make their choice of home health providers or hospital providers, and take them out of the hospital or a doctor's office. And what we've seen in the last few years is that that law is not being followed in the private sector specifically. Doctors may choose to go on a payroll of a home health and hospice. So that practice has really become problematic for every small agency. There's only 2 locally owned agencies now in this county. That's us and Cornerstone. So I would propose a long-term solution would be that we institute a patient bill of rights to guarantee Cherokee citizens choice of their home health or hospice provider, not only from our own providers and own hospitals, but also any contract health doctor we send them to. Because we can send the patient on contract health to Tulsa, and then that doctor will route the patient to a private party or for-profit agency. So we're seeing patients move around as a resource, therefore we end up with more non-funded patients. So that would be the best long-term solution rather than anything else. That puts us on a more even keel with our competition.
So I know what you're saying then, the patient's bill of rights, Cherokees that, which they're supposed to have already, but with the doctors on, and with the home health agency, they direct them to that one. We don't really give them a choice because they don't know the difference.
We get those reports very often from our patients.
It's good information to consider.
One last question. Since we have George Value here from the Iowa Indian Hospital, has IHS I mean, are you working with them? I mean, is that an issue at the Cromwell facility that they need to be included in this discussion and that Dr. Green, Lori Green can assist with that?
I think it would be wise.
So that choice isn't being given at Cromwell Indian Hospital now, or we're not clear if it is, and we have an opportunity there?
We've been there, we're not clear. Give you a sense of perspective. In the last 10 years, our service hours, patients in the home is approaching 2 million. So when we spend that many hours in the home with patients, we get quite a bit of feedback.
One, just to clarify, we have never used contract health funds to pay for home health. And two, I agree with what Rick's saying, except a little bit further, I think we should preferentially have be able to send our patients to Cherokee Nation Home Health because it is part of our expertise. And I know it's a little bit difficult with some of the laws, but I think that we should preferentially send, including all the retained patients.
So, and I agree with that statement. In order to add to the discussion that health council is making good perspective, if the doctor mandates where the patient goes and there's problems in the care, typically the patient is afraid to dismiss that agency. But the agency chooses that, the patient chooses that agency and there's problems with the care. Usually the patient and their family feel more empowered to terminate that agreement and seek other care. So that's what I feel important for the patients to choose.
Madam Chair, did I understand you to say that before this was moved to a not-for-profit entity, this was being handled in-house, the reimbursement rates were lower?
What happened was, in '97, the balanced budget amendment actually lowered home health reimbursement rates. And so we were under the tribal umbrella at that time, and it made it impossible for us to pay the benefits cost and the indirect costs. So we moved the agency outside, so we know the cost would be avoided. We were able to absorb the cuts. And so we operated fairly even up until 3 years ago. The economy was sound, and we saw these trends in healthcare start to really move against us.
I know there's a difference between a community health representative who works out of the clinic and contract care or a home health person. Is any work that you're doing, work that could be performed by a community health representative out of any benefit speak to that out of our clinics? I know we don't have the numbers to do it, but is that something we can do and capture any of that home health coverage?
There would be more public health nursing than the community health representatives. Those are non-licensed types of individuals. Our public health nursing does do a rule of things that we classify as home health, and it's usually in the case when there is nobody else to go, so somebody needs wound dressings, those kinds of things, and we have no other funding. Our public health nursing will go out. We try to limit that because that's not really what our scope of our public health nurses are for, but we do use that to kind of fill the gaps. The other thing that we've tried to do that we could probably do a little bit better job of is educating families that maybe they just need some education and giving them, like, for example, just when some changes, bringing them supplies and training them how to do it, and not only seeing them going in once a week, see them 3 times. So we try that.
Thank you. And lastly, since we're going to continue this discussion, should we bring something that I'm sure you brought to us before, which is a breakdown of the services, or the patients by county, so we can have a good idea, and maybe over the course of the last year, 2 years, whatever, we get an idea of where the presence is.
No problem. The trend that I'd like to go ahead and break it down by age also.
seeing a large, growing number of the under 55 group in our services. And where when I started 15 years ago, it was almost zero. Today it's almost 25% of our total. So that's what it's trying to do.
Questions? Anyone else have any questions for this? Sorry, that's again.
Madam Chair, and I know we're under discussion right now, and maybe for the next discussion, come to committee, we could have a representative from the treasurer, so we can know where we're getting, pulling the money from, if we want to, and that will affect the bottom line. I know that'd be your responsibility, Rick, to give a whomever, or
I can do that.
okay, no problem. Thank you. Thank you.
This is all any more discussion? Questions? Okay, at this time.
If nobody else has any questions, I'd like to do a motion to table.
Second.
For 1 month.
All in favor of tabling for a month, let me know what's saying.
Aye.
Opposed? Okay. We'll discuss this again next month.
Chairperson Colbert, I'm assuming now that next month Gloria and Rick will come back to us with some sort of plan.
Thank you. And way of announcements, we're going to have a short presentation here and appreciation for some work that's well done and deserved. And if you come forward, I'll let you introduce yourselves and tell you what you're doing and what this is all about, and who it's for and honor. And we've got a little background noise here with the air conditioning, so a few of us are a little bit hard of hearing, so everyone please speak up.
Thank you for having me. My name is Bill Gillespie. I'm with Employers Support the Garden Reserve, from the Oklahoma Committee. I'm an area chair for Oklahoma. And I'm here today to present a Patriot Award to both Dr. Scrim. We are part of the Department of Defense, and we're an all volunteer agency other than our three office staff. So we volunteer a lot of time. Patriot Award, you have a nominee of an employee nominating his supervisor or employer for helping out while they're on military deployment. And what I have today is an award for both doctors, and the nominator is Dr. Thomas E. Franklin, who could not be here today. He was a colonel in the United States Air Force Reserve. And his nomination narrative is identical for both doctors. So I would like to read that. I'm the Director of Emergency Medicine at Cherokee Nation's Hastings Hospital in Tahlequah, Oklahoma. The emergency department is typically busy and difficult to staff with emergency physicians. My employer acknowledges this fact and still encourages and supports my participation in the Air Force Reserve as a former squadron commander in the 507 MDS and current flight surgeon for the 465th ARS at Tankers. All of the senior leaders in the hospital are deserving of this recognition. They've been 100% supportive of my contributions to the defense of this country. They've gone above and beyond in their support of me and my family during extended deployments. I am so fortunate to have such a wonderful boss. So, I have 2 awards. Dr. Gloria Graham and Dr. Charles Graham. Your support. Thank you.
Would you like to say something? We just appreciate you coming today. As it's just been Veterans Day, we appreciate everybody that serves in the armed forces, and Cherokee Nation is a very strong supporter of our military. We continue to do so, and we really do appreciate everybody that serves.
Thank you very much.
I don't know if any of you, but I have, in my family, I've been in personal contact with Dr. Franklin, the emergency room, just received wonderful, wonderful care, and couldn't have finer doctors. So I'm sure you put a lot of thought into this and nominating them, and it's always a real sacrifice when people leave their private sector job to go serve for our country. So thank you all very much. I'm sure he would love to have been here today. Do we have any other announcements?